So, sort of the good news is that there's not that much new going on. And I think that probably makes us all pretty happy at this point. But let me go ahead and give you the lowdown and sort of the state of the union with regard to COVID. So this slide has not changed from last week. I keep thinking we're going to hear something on the federal contractor vaccine mandate. I'm not seeing anything in the news. No court ruling on that yet. We know the mandate for healthcare workers is in effect per the US Supreme Court. And we also know that the OSHA ETS, which was the vaccine or test requirement for employers with 100 or more employees, was blocked by the Supreme Court, ultimately withdrawn by OSHA. OSHA has sort of said that COVID remains a priority for them. And I do have some, one other thing from them that I'll get to in a minute. But for the moment, that OSHA ETS mandating vaccines for large employers, not something that you particularly need to worry about. I think one of the things that we're going to see right now is Omicron subsiding. A lot of employers who pulled back maybe in December and said either let's not go back to the workplace, or if we've been in the workplace, let's all start working from home again, are going to make a push now in the spring to be back again in the physical workplace. A couple of examples here: American Express, BNY Mellon Corp. So what are you thinking about if that's where you are? Now, obviously, you're manufacturing, you're healthcare, you've been in person this entire time. But for those of us who work in an office, who can do our jobs from home, I think there's been a lot of back and forth over the last sort of year, ever since we started vaccinating. There's been some thought about what do we do now? And you've heard me say this before, but one of the great challenges of the place we are right now is there's no have-tos, or very few have-tos. At the beginning of the pandemic, certainly in Pennsylvania, New Jersey, Delaware, there were a lot of restrictions, or a lot of things you had to do, a lot of things you could not do. And now a lot of it more is you should do, think about doing what works for your workplace. So, and I was just talking to a member recently, and they said, I know you say, I've heard you say a million times, the employer has a duty to provide a safe workplace under OSHA. So yes, you do. So what does that mean? Well, what do you really need to be doing? Like I said, there's not a lot of mandates out there at the moment, but you want to follow what the CDC is doing. You want to follow what your local Department of Health is doing. That's a bare minimum. Follow federal regulations, follow state health and safety guidelines. I still think a written safety plan makes sense. It's a real short plan at this point, probably. You're talking about masking, you're talking about social distancing, you're talking about vaccines. You're talking about your protocol for when you have a positive test in the workplace, or when you have exposure, or an employee who's been exposed either in the workplace or somewhere else. But it does make sense, I think, still to have those expectations laid out, and have them laid out before you have an issue. And if you're going to continue to mandate masking, continue to mandate social distancing, if you're going to mandate vaccines, what's the alternative if people are not going to comply? It doesn't, with any other rule you have, if there's no teeth to it, it really doesn't make any sense. And I think what we're seeing around masking certainly is, one of the last places that there's been mandatory masking. There have been some workplaces in the schools, and we're starting to see the schools are going to drop their mask mandates. And so I think the more and more people are out and about in their everyday lives and not masking, you may get more and more resistance in the workplace if you're still doing that. OSHA did issue masking FAQs in late January. We'll send the link around to that with the email that comes out after this webinar. But kind of interesting, if you're still thinking about masking issues, it's a good idea to see what OSHA has to say on the topic. So what other things should you be thinking about? You should still be thinking about vaccines. If you haven't done it already, I think it makes a lot of sense. You've heard me say it a million times, track vaccination. You are allowed to track vaccination. That is permitted under the ADA. Just keep the information confidential. Do you want to issue a vaccine mandate? Generally speaking, these lawsuits by private employers have gone in favor of the private employers. We just recently saw the Philadelphia police mandate upheld by a panel of arbitrators. Keep in mind that any policy needs to allow for at least the process of reasonable accommodation for disability and religious reasons. It doesn't mean that automatically if someone raises their hand and says, I have a medical issue, I have a religious issue, it doesn't automatically mean that they are exempt from your vaccine mandate. It just means you have to go through an interactive process with them. And we do have, for members in the portal, we do have policies both for mandatory vaccination and for voluntary vaccination. I think it's even good if you're just going to encourage vaccination to have that in writing. I think it's important for your employees to see that and to know that. And of course, maybe we're back to carrots and sticks. Is there anything you want to do to try to get those holdouts vaccinated? And then, of course, one of the things you can do, even if you don't want to do a bonus, you don't want to do anything else, it's time off to get vaccinated. It's time off to recover from the booster or from the vaccine. And these are just guidelines I have in here, but they were in the ETS. So I think they're kind of helpful. 4 hours to get vaccinated, 2 days to recover. And then I'm just going to keep these slides in here unless or until CDC changes something, because I think they're a great resource. And these are the current rules around isolation and around exposure, quarantine for exposure. All right, like I said, kind of a light week, and we kind of hope that's the trend, right? That we don't see another wave, and that things get back to some sense of normalcy as we go into the warmer weather.
That would be good, Amy, for sure. We did have one question come in at the end. At what point in the hiring process could you ask for the vaccine card? Do you wait till you make an offer, or can you do it earlier?
So I think there's probably a couple of different ways to do this. And those of you who know me know I'm fairly conservative. So my suggestion would be that you let any candidate know that if you have a vaccine mandate, that let them know you have the mandate, put it in your postings, tell them that it's going to be a condition of employment, kind of like a drug test or a background check, and it's going to go in the offer letter. And if they can't produce a vaccine card, a valid vaccine card, the offer is going to get withdrawn.
Okay, there's another question came in. The CDC recommends people with COVID in the last 90 days don't need to quarantine if they're exposed. Can an employer ask employees had COVID and ask for documentation?
It's an interesting question. So I think if you're following CDC guidance and and again, I would recommend that you have a policy that's talking about the CDC guidance, then yeah, I think EEOC would be okay with you asking for that documentation.
You also have to bear in mind someone might have done an at-home test, be very difficult to get the documentation.
True.
But yeah, good question there, John. All right, I think we've covered everything. Thank you all for joining us. Hopefully you took something out of it. Like I said, we're going to keep trying to give you different ways to look at the world these days, especially around people's side. And thank you for joining us. Again, thanks to Amy, Dave, and Tracy as well. Hope you all have a good week. Thank you.